Hi, welcome to Stay Strong Online. I'm Aileen, and I'll be going through some exercises, some fascial stretches, some movement for the shoulders. So let's get started. I am a registered physiotherapist. I've been a therapist now for 35 years. Wow, where the time goes. I'm also a Pilates instructor, and I work at Haley Rehab in Ottawa. So big shout out to Louise Haley, who runs Haley Rehab, and we work primarily with cancer patients at Haley Rehab. So we're doing these videos to just help you out at home so you have extra exercises to do. We're not a replacement for your physiotherapist. We're not a replacement for your personal trainer. We're trying to give you modifications so everybody's at a different level, but everybody needs to move, needs to breathe. Breathing is not an option, so let's breathe optimally, and you need to have a tall posture to breathe. If you're compressed, if you're over a computer, if you're in pain, your diaphragm is not working as effectively as it should, and you're not getting the oxygen in to the bloodstream, to the muscles, to help with healing. So pull up, bring those shoulders down, feel no tension in the neck, and we're going to start with just a little bit of sharp arm movements just to get the blood flowing. So you can be doing this sitting on a chair or on a mat, wherever you feel comfortable. Pulled up, abdominals in, ribs connected to those hips, shoulders down. Let's start with 8, starting with a fist and then releasing. 1, 2, 3, 4, 5, 6, 7, 8, and side. 2, 3, 4, 5, 6, 7, 8. Reach up. 2, 3, 4, 5, 6, 7, 8, and forward. 2, 3, 4, 5, 6, 7, 8. Again. 2, 3, 4, 5, 6, 7, 8, and out. 2, 3, 4, 5, 6, 7, 8, and up. 2, 4, 5, 6, 7, 8, down. 2, 4, 5, 6, 7, 8. Last time. 5, 6, 7, 8. I feel my triceps jiggling. 8 and up. 2, 3, 4, 5, 6, 7, and down. 2, 3, 4, 5, 6, 7, 8. Great. Heels together. If you can't get in this position, put your legs in front of you, hands underneath the knees. If you're sitting on the bed, just put your hands by your side. We're just going to contract and relax the thoracic spine. So wherever you feel comfortable, ribs in, head tall, no tension in the neck. Relax those shoulders. Deep breath in to start. Exhale, roll back on that tailbone. Inhale, come back up. So we're just stretching the back a little bit. Exhale. Inhale, come back up. Exhale, roll back down. Inhale, up. Last time. Exhale, roll. Inhale, up. Now place your right hand by your hip. Cross your left hand over top. We're going to do the same exercise, but we're going to kind of diagonally go back. Just, you won't get as much movement, but you'll get a bit of a stretch. So just roll back and up, pull in the abs, roll back and up. On to the other side. Hand by the hip, hand on the shoulder, pulled up on the inhale, exhale, contract back. So I'm getting a bit of a stretch through here. And up and exhale back. So when I go back, the opposite knee is pushing. So there's a bit of a tractioning on the arm. And up and contract and up. Last time, contract and up. Legs just over here, and I just want you to rotate to get a little bit of thoracic stretch. Let's put the hands in the prayer position. Good, and open them up. Hands in the prayer position. Keep those abdominals engaged. Open up. Hands in the prayer position. Open up. Just a little bit of rotation. Where you could go, but feel tall when you rotate. Do not collapse. And back let's just stretch those palms this way. Great. Next we're going to go onto our side. So one leg in front. If you want, you could put the pillow underneath that hip, and you're going to go down on the side elbow. With the opposite arm, you're going to reach diagonally forward, stretch out, then bring your hand to your heart and extend it up. Pull up this way, reach, rotate. So we're doing a lot of thoracic rotation, neck rotation. We're not just working in that one area of where you have had the cancer. We're trying to stretch and mobilize everything around. So again, bring the hand to the heart, reach up, hand back to the heart, reach down, pull yourself up, and switch over to the other side. I have our little, I don't know if you can see in the corner, our rescue dog Willow, who is now a year old. So let's go down on this elbow, reach diagonally forward, bring the hand to the heart, elbow up, stretch it up to the ceiling. Hand to the heart, reach out. Hand to the heart, reach up. Hand to the heart, reach down. Hand to the heart, reach up. Hand to the heart, reach down. 2 more times. Willow comes from Crow Lake in northern Manitoba, and we got her from an organization called Freedom Dog Rescue. We were told she was a shepherd husky. Can't really see her now, but she looks more like a shepherd corgi. She's a great little girl. All right, so next, sitting up. Before we roll down, we're going to pull up, shoulders down, and as we roll down, we're going to roll back on our tailbone. We're going to roll onto our spine and make sure our head is in proper place. So feet are hip distance apart. Again, the hip bones and the pubic bone, nice triangle, not tilted. We're not in the imprint position. We're not popping our ribs. Everything is connected. Hands by your side. I don't need a pillow. If you're a little bit rounded in thoracic spine, you may need a pillow. So just lifting one arm overhead and then switching. Go where you can go. Inhale at the top. Exhale when you bring the arms to the floor. Inhale at the top. Exhale. So inhale, feel the abdominals work on the exhale. So you're getting the range that you're optimally getting by doing this. If you don't breathe properly, you can pop, right? I don't want the popping, so just open. Good. And let's just make it a fluid movement. So let's go for 10. 1, 2, 3. And try to keep your eyes focused sort of over your knees, above your knees. I think we're at 6, 7, 8, 9, 10. Hands to the in front of you. We're going to just do a little bit of open and close. Now, again, on the affected side, you can bring it a pillow or something to support yourself if you cannot get that arm fully open. So I want you to keep those ribs down and just go as far as you can. Again, if you start compensating, that shoulder comes forward, the ribs pop up. So do what you can do. Arms here. We're going to inhale here. As we open, we're going to exhale, and the reason that's going to use our abdominals. Inhale to close. Exhale to open where you can. Inhale to close. Exhale to open. Inhale to close. Exhale to open. Let's keep doing this. What you're working towards is symmetry. And again, I have to adjust my neck and head. Make sure my feet are well placed. Good. 2 more. Open and close. Good. Place your feet a little wider, and maybe on the outside of your mat or a little wider on your bed. Tailbone is still down, pubic bone, hip bones, ribs connected. Arms, again, where you can place them. If you can place them at 90 degrees, wonderful. If they're at 45, that is absolutely fine. If you need the support of a pillow, put the pillow underneath your arms. We want to work the strength of our shoulders. Again, I do not want to see this. So I would rather see 2 pillows propped up and the arms out and extended and feeling the back chain of those shoulders working than collapsing and getting that contraction forward. So I'll show you with this pillow on this side. So arm is out, and with that I can push. So even though I'm going to be doing some leg work, I'm pushing with the arms. Eyes diagonally front, no tension on neck. Let your knees rotate to one side. You should feel the stretch here. Take a big inhale. As you exhale, pull in the abdominals and bring the legs back to the starting position. Rotate the legs to the other side. Take a big inhale. Exhale. Come back. Inhale. Exhale. Come back. Inhale. And exhale. Come back. At the same time we're doing this, try to push your arms into the floor. So you're engaging those posterior muscles. And again, we're working towards symmetry on one side and the other side. But most times you will feel one side tighter, one side weaker. So you can take some time. If you feel one side that's a bit tighter, for me, it's this side. So I'm going to hold this stretch and just give it a little bit more. Take another 2 deep breaths there. Breathing helps so much. Inhale. And as the exhale, just try to deepen that stretch. One more time. Inhale. And exhale. Deepen that stretch. Great. I tend to say great a lot. I think I need to get a new word. All right. Legs extended in a V. Actually, let's keep them a little bit bent for right now. Lift one arm over top of your head. Straighten the opposite leg, pushing that heel down. Now take the same arm as leg and cross it over with the heel. Stretch the top leg and try to do a little bit of a C curve. So we're stretching the fascia all along. If you need a pillow on top to stretch, that it does just as good of a job. So take a deep breath in there and exhale. Really reach. Reach with the top leg. Great. And then bring the leg back. And we're going to switch sides. One arm over top. Keep the ribs down. Extend the leg with the heel. Stretch the arm. Same leg as arm crosses over top. And we reach with the arm and the leg. And we reach even with the other arm. Take a breath there. Big breath. And out. And big breath. And out. Great. Just to finish up, cross one leg over the top of the other. Bring the knee into the chest. Hand on the heel, other hand on the knee, and just give yourself a little massage of that hip. Just nice and easy. Good. And in the other direction. Just do about 4 easy stretches. Good. Drop the leg. Switch sides. Lift, cross, bring the leg in, hand on the heel, hand on the knee, and you're actually with your arms sort of massaging and moving that hip. Good, Nice, easy, 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 easy. And the other direction. Good, relax the tension in your neck. Keep breathing. Good. Lift one leg up, hold it there. Lift the other leg up. Lift the arms up. And this helps with relaxation and also just to get the circulation, lymphatic drainage, just moving. Circle in one direction, circle in the other direction. Good. Knees in, lower one leg, lower the other leg. Roll to your side. Great. So that's this session. I hope it helped you open up, move the fascia, loosen up, and that you feel a little bit better. So keep doing the exercises, keep moving, stay balanced, stay active, and stay strong. And hopefully we'll see you next time. And little Willow is done for the day, I think. Take care. Bye for now.